Hi, Benedict here again. Welcome back to our channel. Today we look at hypertension briefly. What comes to mind when you hear hypertension? Hypertension is simply high blood pressure. In Ghana, we always say blood pressure. Others also say hypertension. What's the difference? And what comes to mind when you hear both of them? Now, let's look at this. Blood pressure is in everyone. Blood pressure is simply the pressure at which the blood is pumped. And I guess this is common in every organism. But high blood pressure, which is hypertension, is when your blood pressure is high, above the normal. And we wouldn't go much into the figures today, which would confuse you. So we are just looking at the basics today. So what is hypertension in itself? Hypertension is simply, as I said earlier, high blood pressure. And how does this occur? Hypertension occurs when your blood levels, the pressure levels, exceed a certain range. And it's mostly diagnosed over a period of time. It's not a day or two that we can diagnose hypertension. We look at it for a period. Let's say in a week or in 2 weeks, we look at your readings consistently, morning, evening, for like 14 days. That's how come we arrive at the determination or at the diagnosis of hypertension. Hypertension is also known as the silent killer. Why do we call it the silent killer? It's a silent killer because you might not even experience symptoms or have anything showing you have it. So you check and the figures show you have high blood pressure. How do you control your blood pressure? What happens when you get hypertension? And how do you manage it when you have hypertension? Now, let's look at how you control it, or let's look at some risk factors of hypertension. Avoid consuming too much alcohol. Obesity is also a factor. Sedentary lifestyle could also be a factor. And your temper issues could also be a factor in getting hypertension. And now let's look at how to control it when you have. There are so many drugs used in combating hypertension. But let's know this. Hypertension is not completely cured. It is managed. So we have drugs we use in managing hypertension. These drugs are called antihypertensives. Antihypertensives are mostly prescribed and bought from pharmacies and are not sold without prescription. That's the right way to go. We do not have to sell antihypertensives without prescription. How do you manage hypertension when you have it? First, you need to look at your salt intake. 2, if you consume alcohol, you need to reduce the intake of alcohol. As well as if you are obese, you need to look at your weight and then your diet. You also need to take care of yourself. Your physical activity is also very, very much important. And in managing hypertension, you should do regular BP checks. BP checks, I simply mean your blood pressure checks. At least when you are newly diagnosed, you need to be checking your blood pressure at least twice in a day to see the trend of your figures, how they are moving and how they are increasing. Let me chip in this. We also have low blood pressure. That is called hypotension. Hypotension, which isn't too common. It exists, but not as common as hypertension. With hypotension, we also give drugs that help in elevating the blood pressure to the normal level. In our next episode, we look at the effects of hypertension, what hypertension can do to you as a person, what it can lead into, and then other things hypertension can also bring to your health and cause to your normal living as a human being. Thank you for today.